Okay, excuse me. The next assessment that we'll be talking about is hip extension. So we'll be assessing extension of the iliofemoral joint. Muscles that we'll be assessing with this are the psoas, the rectus femoris, the TFL, the sartorius, and the adductor complex. So we're going to have our person supine, hips in line with the edge of the table. We're going to have them hold and pull in the knee that we are not testing. And then we're going to extend. We're going to have like the hip as much as in neutral as possible. And then we're going to bend the knee at 90 degrees so that way we can passively pull them to extension. So when we pull them to extension, we're going to grab the base of the lower leg and then have our thumb on the ASIS and then just passively pull them down until you see any anterior pelvic tilting or lateral trunk flexion. That is where we're going to stop. So right before you see any of that, we're going to ask the patient to hold this position, and then we're going to place the application head on the lateral side of the hip, centered with like the side of the hip right here. And we're going to take the stationary head and align it with the trunk. So draw a line right down the middle of the trunk. Then we're going to take our measuring head and align it down the femur, the lateral side of the femur. And then we're going to take our measurements there. When we do that, it should be anywhere from 0 to -10 degrees is the optimal range of motion here. So if someone were to have like a 5 or 10 degrees range of motion with hip extension, we would assume that some underactive muscles that are limiting this range of motion would be our gluteus medius or gluteus maximus, the hamstring complex, as well as the abductor magnus.